Started your 2 minutes time. Total 4 pages.
Next page, ma'am. Yes, next page. Ma'am, second page, please.
Uh, Fourth page.
Yes, 4 pages. Okay. Okay, next.
Done. The first one you want to see?
Yeah, ma'am.
Started your 10 minutes time.
Okay. Hello, I'm Dr. Taskeen, one of the doctors here today. Can I confirm your name and age, please?
Yeah, I am Lauren Fay and I am 30-year-old.
Okay, how may I address you?
And Lauren is fine.
All right, Lauren. I got your GP letter, and I'm aware that you want to plan a pregnancy, and you have a condition called as epilepsy. Am I right?
Yeah.
Okay. Any other concerns or expectations today?
Yeah, doctor. I just wanted to know how I should get pregnant. What are my risks? What are risks to me and my baby? And whether this will affect my pregnancy course and my labor, and whether my baby is going to have the epilepsy. Multiple concerns are coming to my head when it comes to this.
Yeah, definitely. I really appreciate your efforts of coming forward to this clinic, and it's really one of the important steps for your future healthy pregnancy and the outcome. Okay, Lauren, I'll address your all concern, and together we'll formulate a safe and best plan for you. And then I'll be giving you written information also. Before that, is it okay if I ask you a few questions to know more about you?
Okay.
Okay. Yeah, I see from the GP letter that you have a grand mal epilepsy, and it has been like once you were 5 years before, 5 years of age. How is the control nowadays?
Actually, I'm on this tablet EPILEM, so I'm having a very good control on this. And my last seizure was 1 year back. Although at that time, the doctor said that since I discussed the option of getting pregnant, he has changed it to some tablet known as lamotrigine. But I was having constant fear of getting seizure, so I changed it to EPILEM again.
Okay, did the specialist change it or you change it yourself?
I visited a GP. I insisted them.
All right. And do you have any recent hospitalizations for this condition?
No. No.
Okay, that's fine. And Lauren, what about your periods?
My periods are regular.
Okay, when was your last menstrual period?
My last period was 2 week back.
Okay, are you practicing any contraceptive?
No. as of now, I am keen to get pregnant, so not means a condom is using, but no other contraception.
Okay, fine. And do you have any other medical condition?
No.
Okay. Apart from this medicine, are you taking any other medicines?
I have been started myself on folic acid, 400 microgram.
Okay, that's good. And any known allergies? Yes, I can see that you're allergic to penicillin. Any other allergies?
No.
Okay. And any surgeries done in the past?
Yeah, I had undergone the laparoscopic
Okay.
appendectomy.
Yeah. Okay. And how was the recovery thereafter?
Yeah, and things are pretty normal.
And Lauren, are you updated with your smears?
Yes.
And are you vaccinated against rubella?
Yes.
Okay. And do you have any other, any other family member with this condition or this runs in the family? Any such history?
Uh, no, no, no. My mother is having 3 kids. I am only
Mhm.
having this. No other member is having this.
All right. And I can see you don't smoke, but you drink occasionally alcohol and recreational drugs for fun.
No.
All right. And how's your support at home?
Yeah, I am very well supported. I'm married 2 year back. Yeah, very
Mhm.
well supported.
Okay. Okay. Have you tried for the baby before this?
Uh, no, actually, I had discussed the option of getting pregnant a year back, but I haven't yet tried. I want to be 100% sure.
All right. Nice. And is your partner fit and healthy otherwise?
Yeah.
Okay, that's fine. Thank you for sharing this information. Would you like anything else to add on?
No.
All right. Can I just quickly examine you in the presence of chaperone? My nurse will check your heart rate and blood pressure, and a general examination will be done. Is that okay?
Okay.
Thank you. Thank you for your cooperation, Lauren. Now, coming to your condition, that is the epilepsy and the pregnancy. So, let me tell you, most of the women with this condition do manage a healthy pregnancy and a healthy outcome. And depending whether they are adherent to their treatment as well as have regular checkups. Okay.
Hmm.
Although there are some risks both to the mother and the baby, so I'll discuss with that with both with you and what will be the effect of pregnancy on the epilepsy. First of all, like if you have a well control before you embark the pregnancy, that is a good. Most of the course of pregnancy will be fine. Only one third may have a flare, especially if they have some like stressors, like if they have some sleep deprivation or they are feeling stressed. That time they can have the flare, and once they are not adherent to their medicines. Okay,
Okay.
clear to you so far?
Yes.
Yes. So, what about the effect of its on mother? We can see that there can be sometimes there can be the occurrence of epilepsy during pregnancy, and that may require the treatment and sometimes the hospitalization. And sometimes there can be like if one is not adherent to the medicine, there is a very rare chance of sudden death in the pregnancy, which we call as a SUDEP. I'm not trying to scare you, but it's just for your information. Is it okay?
Okay.
Yeah. And Lauren, there are some risks to the baby, like there can be slight risk of miscarriage, or there can be a baby can grow smaller in the womb, and as well as there can be a risk of baby delivering before the term. So, to mitigate all these effects, your care will be under a team of doctors, including our consultant obstetrician, epilepsy
Hmm.
specialist doctor, specialist midwife, as well as the baby doctor and the counselors. Am I clear to you?
Okay.
Okay, so as far as once you're pregnant, then your care will be in a consultant-led care. It will be just reviewing your medications, okay, and
Hmm.
so as to have baby-safe drugs, okay,
Okay.
and as well as you may need to start on a folic acid, but the dose has to be larger. That's 5 milligrams. You can start it this time also before pregnancy, and you have to continue it throughout your pregnancy. what is it actually decreases the risk of congenital abnormalities in the baby. Okay.
Okay.
Yes. What happens? We'll be putting you under a regular care with frequent checkups, and as well as we will do the regular scans for the baby, apart from the routine scans and the early viability scan at 7 to 9 weeks. Am I clear to you so far?
Okay.
So now, as this, now you are contemplating a pregnancy. So first of all, I'd like to, as I told you, that you can start with the folic acid. I'll give a prescription for that to increase the dose to 5 milligrams, and we'll connect you to us, your specialist doctor, because your medicine needs to be reviewed by the specialist. Till then,
Is
you
this
need to.
medicine is safe, doctor? Is this medicine is safe?
Yes, what happens, Lauren? This valproate, this is a medicine which can cause the congenital abnormalities in the baby relating to the heart or the abnormality of the back. So for that, you need to meet a specialist doctor who can review this medication and either decrease the dose or change to some other baby-friendly medicine. Okay.
Okay.
Till then, actually, what happens, you have to continue this medication because it's very important to have your scissors under control. Okay.
Okay.
Yeah. So I'll also made your appointment with the specialist doctor. Until then, as you told that you're not using any contraceptive, Lauren, that's important to have some contraceptive because until your medicines are reviewed and your condition is optimized, you need to have a effective contraception. Am I clear to you?
Okay. Okay. Okay.
I'll connect you to the contraceptive services, and for that, you may have to start the contraception till you get okay from your specialist doctor. Am I clear to you?
Yes, quite clear, doctor.
Do you have any questions till now, Lauren?
No, I'm just worried about my baby also, doctor. Will my baby be also having the similar condition?
Yeah, it depends. Like what happens, as we see, there is no familial reason for your epilepsy. So we can also discuss with the neurologist, the epilepsy specialist doctor for the same. It's rarely it runs in families, but for that, it's better a neurologist and or a epilepsy specialist will be the better person to answer this question. Am I clear?
Another question is, how you are going to deliver me?
Yes, definitely. Lauren, there is epilepsy as such is not a contraindication. Is like you can choose a vaginal delivery also, but we'll have the meeting at 30 to 34 weeks with a team of doctors, depending upon the other factors. Okay. As such, there's no any problem with the epilepsy unless there are other conditions. So, but delivery has to be in a hospital with a consultant-led unit, and also we have to continuously monitor your baby throughout the pregnancy. We'll discuss the pain relief options with you, but we need to avoid some medicine like pethidine in you. Okay. So
Okay.
once the baby will be delivered, baby will be taken care by the baby doctor, and we will also give you some medicines which can decrease the bleeding after the delivery. Am I clear to you?
Okay. Yes.
Yeah. So once the baby is born, you will be again reviewed by the specialist doctor, and you need a support. As breastfeeding counselors will help you, and you need to be well hydrated as well as have adequate sleep and the pain relief, because there are chances that the epilepsy can precipitate the seizures can precipitate immediately in the postpartum period. Okay.
Okay, doctor. Thank you.
Okay, I'll giving you this written information and I'll give the prescription for folic acid, also connect you to the specialist doctor and also the contraceptive services. Is that fine?
Yeah.
Okay, I'll be writing back to your GP and thanks for coming.
Thank you, doctor. 2 minute extra time.
Oh, this is such a long stage.
No, but see, the history you do not need to ask, dear. Okay, if you can read it out, hardly you need to ask any few things. Contraception they had not asked. LMP they had not asked. Rest all history has been given. The last fit also they had given.
Yes, ma'am, yeah.
Okay, so here you took a time. See,
Mm-hmm.
you asked me maximum history. Smear, you can skip also, nothing to worry. Contraception, are you on any effective contraception as of now? When was your last period? Till you get a green signal from your doctor, please continue. Means we will refer you to a contraception for effective contraception, as we need to switch from this medication to the safer baby friendly medication. That we know. Your time for history taking was 4 minutes 50 seconds. You do not need to examine this patient. I had told 2 3 times, actually not several times, but when the patient is coming to means coming for you, coming to see you, uh, most of the time it's a consultation. Many a times they do not want to offer the examination. See, BMI was given here. The BMI is 24. They generally get screened at GP level. It is actually a counseling session. The allergic, so do not assume. And it has been mentioned she does not suffer from any other medical disorder. So what you are worried about? You are worried about blood pressure only. If she's not having any other concern, so what examination you are going to offer her? What you want to see?
Yes, ma'am, you're right.
Hmm?
Yeah,
So
yeah,
she's
you're
not
right.
having any medical history. Her BMI is normal, and rest everything was given. So if it is a big station, you have got adequate time to complete this task. Understand? Okay, so whenever such kind of things comes up to you and you are not you yes, in within that 2 minutes time, it is very difficult to concentrate, read it out, but go slowly. Okay, take breaths, read it out in front of the patient. Okay, whatever you can, read it out. Okay, so I can see that the GP has mentioned you have been diagnosed as a case of epilepsy since the age of 5 years. It's a grand mal. You are currently taking tablet epilium, and your kid fits are under very control. And your last visit was, if it was 12 months back. So when was your last visit to your doctor? Had he or she given you a green signal for this? No, doctor. Actually, I had discussed a year back, but then he has not said. Okay. So this is your complete epilepsy history. Hmm? Then marital history is given. Periods are regular, but LMP is not given. So ask her LMP. Contraception you need to ask. Mere can be kept, can be asked, can be left also. Okay. Mm,
Okay.
does not smoke alcohol socially. No need to ask recreational drugs. Why you are introducing recreational drugs in every each and every station? I don't understand. She does not suffer from any other medical disorder. She had laparoscopy 3 years ago. It is for ruptured ovarian cyst. I said appendectomy. BMI is normal, allergic to penicillin, and EpiPen is epinephrine, which she carries in case of severe allergic penicillin reaction. Okay, so please carry that. That is the only thing what you can say. So she's having her card also. She's having everything. So, and any family history of similar complaints in the family or anything runs in the family, you can ask that history. So 2 3 points in the history. Your history should have been completed by 2 minutes 30 seconds. So that last 30 seconds you could have been saved. Okay. So there
Yeah.
you, yeah, you took that much time. Now coming to the other options. So acknowledge or otherwise read the information which has been given to you. No, not to ask recreational drugs, not to offer examination, dear here. Then specific PIL and specific support group. Specific support group. Keep on telling you people. Hmm? Epilepsy in pregnancy. I will share the PIL of epilepsy in pregnancy, and epilepsy registry is there. We will register you once you will get pregnant. You will register. You will get registered in that epilepsy registry, and epilepsy action and epilepsy society. These are two uh, groups. Okay, two groups. So this actually the time management was the only issue. Apart from that, it was a wonderful station. Anybody wants to comment on her performance? Then we will go through the answer key. Anybody?
Consultant absence, she has to acknowledge that.
Yeah, she had not. Yes, even I had mentioned in the top right bottom. She has not acknowledged that the consultant. You have been referred to the consultant, but the consultant is absent. She has not acknowledged. Very nice. Anything else?
Ma'am, we have to inform her regarding the triggers like you have
Yes.
sound sleep, uh, avoid stress and
Avoid stressor. Avoid stressor. Pethidine she has missed out. There are certain points which she has missed out, but it's still, see, everybody can't be 100%. 80% points she has said, so that is sufficient enough. Few points she has missed. So let's discuss what points she has missed. One is hydration she mentioned at the time of labor, but avoid stressor. Seek early help. Always be accompanied by someone. So these are safety net for this patient. Hmm? Fall
Yeah.
proof strategy, then baby friendly strategy once the baby will be delivered. So these are the safety net for these patients, epilepsy especially. Hmm? Okay, anything
Mhm.
else? Anybody wants to say anything?
Ma'am, risk of postpartum depression.
Yeah, these patients are at risk of postpartum depression. Safety nets, those are the points which you can say. But here my concern was not postpartum, so I will not take that postpartum depression into the consideration. My concern is just planning my pregnancy. If I will be pregnant at that time, you can insist. In my concerns, the postpartum depression was not there. So that's the reason even I have not included it in my answer key. Hmm? But good point.
Ma'am, should we tell about band, epilepsy band? She should.
Mm, she will be having basically, I think she will be having, and her control is very good actually. So that is something discrimination, na dear. If you will be having band and all those things, so sometimes that is discriminational. So we should not
Ma'am,
say something like that. Yes, dear.
early IV access in the labor, ma'am.
Yes, 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 yes. Actually, she will be on epidural, not only pain relief. So she will be asked to see a anesthesiologist at 34 to 36 weeks of times, and epidural will be cited for her to avoid precipitation of epilepsy during labor, and pethidine will be totally avoided in her case as it precipitates the seizure activity. Got it? Got it? Anybody? Okay. Anybody is not keen. Nobody is keen to say anything. Okay.
Risk
Yes,
of
dear.
epilepsy in the baby, 2%,
Uh,
ma'am.
yeah, so there is slightly means it is not actually completely, means that risk is not, it will not, I will not say that, since there is no genetic history in, though no family history, so genetic link of epilepsy will not be there, so less likely. But neurologist here, if I want to say the truth to the patient, as compared to the background population, your baby carries slightly increased risk of epilepsy as compared. It is not very high. Most of the babies will be normal, but yes, it will carry slightly high risk of epilepsy. That will be my sentence here. Yes, it is there because the one parent, 2%, two parents, something like 10% or something like that, or 7-10%, something like that they had mentioned. I haven't read it recently, but something like that. Okay. So, introduction, confirm aim of the consultation, situational awareness, absent consultant. Okay. Setting agenda, exploring concerns. Okay. Very nicely, you had appreciated, and my concerns were multiple. So, in the beginning, only I had said all the concerns. Those are my all concerns. Everything
Mhm.
has been given. You just need to read it out. Okay. uh, have you ever been pregnant? That one question could have been asked, whether there was any history of previous pregnancy. Menstrual history, only LMP has needs to be asked. Okay. LMP. uh, Contraception, whether she's on any contraception. Smear can be skipped, can be asked if you wish. I haven't included in my answer key, so it's up to you. Medical history given, surgical history given, no, allergy given, acknowledge that. Folic acid needs to be started. So my information, yes, the GP has started me on 400 microgram. Then and there also you can say that I will be switching it to the higher dose, that is 5 milligram. Family, anyone in the family? No. Support, how is your partner? Acknowledge alcohol and smoking. Okay. And one more thing I would like to ask here, are you accompanied? What do you do for living? That is occupation. And are you accompanied by someone? Because we need to be aware that epilepsy, they are having a means sudden fall. Sometimes they do fall suddenly. So that to prevent, to take early help, will you be accompanied by someone? Hmm? So that you can have early access, or early you can seek early help. And that's the reason we will like to involve some one of the family member in your care, in spite of that confidentiality issues or something like that. So these pregnancies, did you said high risk pregnancy, dear? I didn't listen to that.
No, I skipped that word. Yeah.
Was that here? How to say that? So it's not a
Okay.
low risk pregnancy, it's a high risk pregnancy, and that's the reason we are booking you under consultant led care unit along with the team of specialists. Yes, the team of specialists will be uh, midwife, specialized midwife, epilepsy midwife, epilepsy nurse, epilepsy doctor, GP, fetal medicine experts, because there might be frequent scans and we need to have a frequent follow-up also. So those will be the people, neonatologist and anesthetist. Those will be the people involved in the care. Uh, if very nicely you started that if it is under control, the less likely it will go. Means your outcome will be the outcome will be very good. So that reassurance was there, because you can see that the last episode of epilepsy was a year back. Okay, so that has been completely means the counseling started very nicely. Here I had just given a involve family member, so that at any time you think that you are having some feet or any problem, then you can contact 24 by 7 details. And there are certain baby friendly measures when baby will be born. So I had included here only because I might not get time after some time, or I might be concentrated on something else. So implications to the mother and to the baby. Most women remain seizure free during pregnancy and will have straightforward pregnancy with healthy baby. 17 out of 100 women with epilepsy, seizure frequency can be increased. It is important to continue taking your medication, because having frequent seizure during pregnancy can be harmful for you and your baby than the minimal complications of medicines. So compliance is very, very important. Hence, being compliant is very important. A very rare but serious complication of poorly controlled epilepsy is sudden unexpected death with epilepsy. If the person are missing out on their treatment modalities, then there is a chances of sudden unexplained death in epilepsy. We call it as SUDEP, as you rightly mentioned. But in her case, reassurance. Most types of epilepsy will not cause any harm to you or your baby. So something like that you can say. If it is under control, less likely it will get a bad outcome or bad prognosis. With any pregnancy, there is a small chance that your baby may not develop normally in the womb. The risk of happening this will be slightly higher with certain epilepsy medication. So that congenital abnormalities you need to say dear here, because all epilepsy drugs, most of the epilepsy drugs are associated with some risk of congenital abnormalities, especially neural to defects, spina bifida. Hmm? Yes or no?
Yes. Yes, ma'am. Yeah.
Yeah. So at least you need to explain her that okay, so medications, although they are safe, but there is a possibility. There is a possibility. You just need to make aware her that all the risk and complications you will be explaining to her. The risk dependent on the type of medication you are taking and the doses of the medication. So yes, we are going to refer you to the neurologist or a epilepsy doctor for a safer medications which will be baby friendly. Lamotrigine, yes, definitely it's a baby friendly. But if you are thinking
Mhm.
that your seizure might come up, then there are alternative medications which can be started for you. But tablet epilium is not safe during pregnancy. When I asked you whether it is safe or not, your first reaction was yes. It means what I should take it from that sentence. When I asked you, is this medication is safe because I'm taking epilium, is this medication is safe? Your first response was yes. What I should take from this medication, this
Yeah, it
you
will wrongly imply to the patient that it is safe. So I should have straightway said, no, it's not safe in pregnancy.
Yeah, so it's not
Yeah.
safe. The risk of having complication with epithelium, that is congenital abnormalities, along with that, there will be a risk of behavioral abnormalities, developmental abnormalities in the babies like autism, ADHD, and that's the reason these drugs are nowadays not being prescribed or not safe, found to be safe during pregnancy. So it's better that you will be switched to a safer medication, safer prescription. Till that time, use effective contraception. Once your epilepsy will be controlled, we can give you a green signal. Yes?
Yes, ma'am.
Yeah. And for baby, epilepsy per se will cause small increased risk of miscarriages, early deliveries, and sometimes baby might die in the womb. So these are small risk, okay? Folic acid, okay, and all the complications most of the time will be reduced by taking folic acid. So you need to take a folic acid regularly, which will be 5 milligram. Neurologist appointment to review your condition and drugs change needs to be changed. For high dose folic acid, at least for the first 3 months of the pregnancy, can be continued throughout. Uh, in order to minimize the risk to your antenatal care will be planned by MDT. So I all the options of MDT has been discussed here. Frequent visit, and here you can just say that yeah, more frequent visit, more scans, more follow up you need to have, because here you cannot explain it in detail. You are not going to have increased risk of preeclampsia or VT. So only concern will be baby might be having SGA, or baby might be having some congenital abnormalities. So a fetal medicine people will be involved in your care. At 36 weeks, anesthesia consultation will be offered to you to discuss pain management. All types of pain medications can be offered to you except pethidine. This is very important here, huh? Patient safety point. And during labor, she needs to be offered epidural, because it is to minimize the risk of epilepsy. Delivery in
Yes.
hospital, consultant-led care unit, baby doctor will be there. Aim for normal delivery until indication arises. The risk of having seizure during labor is very small, that is 1 in 100, especially your epilepsy is well controlled. Hmm? So epilepsy, if the epilepsy is well controlled, the risk is very less. Throughout labor, we will provide you enough support, makes you sure you will not dehydrated and you will be pain free. Continuous fetal heart rate monitoring will be offered to the baby. One-to-one care. And very nicely, Dr. Manika ma'am has said early IV, because we do not offer IV access to all patients in these cases. Then water birth. One more question will be here, whether water birth is safe or not safe. What is your answer?
Will be not safe.
Yes. You should bring your epilepsy medication to hospital with you and take it as you normally would during your labor. If you do develop seizure, will be offered another medicine to stop seizure and CFEM. If you do develop seizure, will be offered another medicine to stop seizure and is continuous electronic fetal monitoring. If any concern arises, we may have to offer you LSCS, but our aim will be for vaginal delivery. Throughout pregnancy and delivery, we recommend you to have a healthy diet. Drink plenty of water. Do not compromise your sleep. Take adequate rest. Avoid stress, as all this can precipitate seizure. Take shower rather than bath. Do not drive alone. Always make sure that someone with you at home. So these are patient safety points. Okay. Post delivery, your baby will be usually stay with you unless they need extra care. Vitamin K injections can be offered to the baby. Okay. Uh, After birth of the baby, you also will be make sure that you are getting enough support and adequate rest. Very important here, because while nursing the baby, use very shallow baby baths. Keep baby on the floor, lay your baby down if you have warnings, or don't try to nurse baby alone. Epilepsy medication can pass into the baby breast milk, but the amount is usually so small that it is not harmful. Breastfeeding is considered safe if you are taking epilepsy medications. You will be given appointment with the neurologist within 10 days of delivery if your medications were altered during pregnancy. Baby is having small risk of epilepsy compared to a normal population, but high chances, not huge. Okay, high chances that baby will be normal. Contraception. So now closing towards closing. Contraception is stable or new drug. Once you will get pregnant, you will be entered into the epilepsy registry, that is UK Epilepsy Register PIL regarding epilepsy in pregnancy, appointment with neurologist and follow up with the consultant. Once green signal, can plan folic acid 5 milligram, write back to GP, and the support group is Epilepsy Action or Epilepsy Society. Coming to the information gathering, everything was given, so please ensure that you will just acknowledge. Contraception was needed here. This is my red sign. Other medical, social history and husband's health, you need to inquire here. Basically, husband said health, relevant medical history on patient with epilepsy planning pregnancy. This skilled and signposting is not needed. Okay. So most of the
Mhm.
information was given, only few questions you need to ask. Okay. So remember, when the instructions are very high, you do not need to go into that detail here. Hmm.
Ma'am, we
Communication.
need to, ma'am, I'm getting that we need to read it out, at least acknowledge it.
Yes, at least
It's
acknowledge
not
it.
like yeah, yeah,
Yeah.
okay.
Okay, so you just read it out that means you cannot say that I am aware about, I had gone through your GP late and you just start. No, you can do that also. You have to tell her that I can see that your epilepsy is under good control. Your seizure were last 1 year back. So you have to acknowledge and say it to the patient. Hmm. So this is interpretation of the details which was given to you in the format, and that is information gathering in this case. Okay.
Yeah.
Recommends coming of epithelium not advisable in pregnancy because of teratogenicity and potential effect on fertility. Contraception while stabilizing antiepileptic, folic acid 5 milligram, neurologist. Impact of epilepsy on pregnancy and vice versa. Management, how you are going to manage. Medical disorders in the person who will be having interest in medical disorders in pregnancy, that can be uh, means you can discuss with, you can be having MDT with these people. Fetal medicine team for congenital malformation, delivery, postnatal follow-up, including the risk of epilepsy on the baby. Sensitivity, we need to discuss this teratogenicity, delaying pregnancy, until the timing is best for the fetus and the mother. Able to give information to the patient with epilepsy for both or both its impact of the pregnancy on her condition and her condition on pregnancy and the fetus. Communication. So here neurologist, not information leaflet. Information leaflet will be going into communication with patient domain. Okay. Multidisciplinary team when pregnant, primary care, GP, specialist midwife, specialist obstetrician with the interest in medical disorder in pregnancy, fetal medicine, neurologist, and anesthetist, along with nurse specialist. Okay, for epilepsy. Details are confirmed at the start of the task. Awareness about safety of investigation and therapeutic preconceptionally during pregnancy, postnatal period, including safe prescription for the patient with epilepsy. Has an understanding for both the impact of pregnancy on epilepsy condition and the impact of epilepsy on the pregnancy and the fetus. Drug allergy history and safe prescription. Confirms patient details at the start of the task. Safe prescription. A certain drug allergy. Provision of patient leaflets on planned pregnancy. Applied clinical knowledge, demonstrate good knowledge of managing epilepsy in pregnancy and being up to date with the current literature, uh, according to RSOG Green Top guideline. Has appropriate knowledge of preconception, antenatal, postnatal care, including the risk of maternal mortality, morbidity related to epilepsy in this pregnancy. Okay, any question? It was nice station, dear. Nice station. Okay, very nicely done.
Mhm.
Few points
Ma'am,
here and there. One might miss it
okay,
out.
ma'am.
Yeah.
Yeah, ma'am, is the preeclampsia like there's increases of preeclampsia in epilepsy?
No,
No, it's not. Yeah,
it's not. It's not.
it is good.
It is
It's not
see,
there.
in epilepsy, pregnancy is means per se pregnancy will not have any in epilepsy, because of that heavy medications. The patient might not
Yeah.
able to care for her. That is the only concerns what the pregnancy means the what the pregnancy can have, and the baby
And
might be having SGA.
yeah, and due to fall, they can have sometimes injury
Yes,
to themselves
yes,
and to
yes,
the
yes,
baby
yes,
also.
yes, yeah. And that SUDEP is some risk, sudden that is another risk the patient can have, and that is because
Yeah.
of the compliance basically.
Okay. So, ma'am, when we have a preconception plus antenatal management, we have to discuss. Like, once we come to discussion, we have to go for a preconception first, then tell her about the antenatal management. I did
Yes,
reverse.
yes,
Yeah.
yes, 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 yes. So you need to tell her that what you are going to do. So now,
referral to the neurologist, switch to the safer medication, get a good control. Till that time, contraception, continue your folic acid. Once stable, you can go for you can embark on the pregnancy. The pregnancy journey will be apart from routine antenatal care. What extra you are going to offer her? You need, yes, implication. Firstly, you have to tell her the implication. Then, apart from routine antenatal care, that is a dating scan, a detail, your scan will be that detailed anomaly scan will be from the FMU here, because the risk of congenital abnormalities because of the medication is little high, and serial growth scans will be offered to her. Yes.
Okay. Yeah, ma'am, actually, like we start that most of will be fine. Then we tell about the risks. So with risks, we have to mitigate them by telling the antenatal management. So I take then preconception last on. So because
Yeah.
with
So the
risks, we have to
sequencing.
tell her.
Yeah. Yeah.
Yeah.
Sequencing will be preconceptional followed by antenatal.
Okay. Thank you.
Okay. Thank you, dear.
Thank you so much.
Shall